Welcome to ComplyPlus Presents. I'm Richard, and I've got my colleague here, Louis.
How are we doing, Richard? We okay?
I'm good. Have you recovered from last week?
Yeah, it was certainly a first on this
Yeah.
podcast, getting up and doing exercises.
Yeah.
Particularly in this small space, people might not be able to realise actually how small the space is.
Exactly.
here.
I was thinking of health and safety.
Well, yeah, we probably looked quite hypocritical last week, but no, it's always good to have guests, and we're
Yeah.
always, like I say, any potential interesting people out there who want to come on a podcast.
Yeah.
Feel free to get in touch with the team. We're always looking for people with different backgrounds that link with what we're talking about here to share experiences, share their thoughts, and start good conversations. Yeah.
Exactly. But anyway, look, so thanks to Courtney last week, we did some stretching on the podcast. But today we're back to what we normally do. And I'm talking to Louis in a series that we've been doing. I think this is the fourth in the series where we're
Fourth
looking
episode,
at your experiences with health and social care decision makers.
Yes.
On how they adopt technology, how they use it, shall we say, the evidence behind it or lack of evidence behind it. I think there are a lot of assumptions in the sector about how things should be done, how we should adopt technology, and it's not always correct. But we're also giving some ideas on how people can do things better.
Exactly. Yeah.
Okay, so today we're talking about the fact that it takes a lot to get regulatory compliance software or systems to work beyond just going live, right?
Yeah.
So, one of the questions is why successful transformation in health and social care, what's needed for that? And we're saying that it's around people, it's around process, patience, and persistence. Actually, you have to be proactive about it. It's not just going to work because you've got a system, you've set it up, and you've gone live. So the key point here is that we're looking at the realities actually of governance, compliance, and workforce transformation. Because obviously, if we bring in a new technology, people have to buy in. And quite often, my experience, at least in healthcare, even social care, is that when you bring something new, people don't like it.
Yeah, there's an immediate wall sort of put up, isn't there, to say, look, this is not how we do things. And I think that's always the biggest challenge, yeah.
Yeah. So, okay, let's get right into it. So the first part, we're talking about the fact that implementation of any innovation, especially the technological innovations, the software solutions that are available now, our experience is that it's quite often underestimated, actually, what it takes to get successful implementation and what's needed to be done. So if we start at the top, why do organizations underestimate how long it actually takes to get things working properly?
Yeah, I mean, I think the first challenge is almost a society thing now that human beings have been trained to expect to just buy something and it instantly work or instantly have access. We're so used to convenience. And if you like, you could call it the Amazon effect in a way, where people buy something and they expect it to be paid for. And once it's paid for, they download it, they send it out to their staff or they download it on some computers or devices. And all of a sudden, everything's working, everything's there.
So if I download an app,
Exactly, yeah.
Netflix, for example, because I want to watch that one movie, I download it, I'll go straight and watch that movie. It's so convenient.
Exactly, yeah. That's the biggest challenge, really, that I find that people are just expecting this thing to work. They've paid for it. The next day, why isn't this working? This person can't do this. This person can't do that. The second I'd say is the invisible workload. Like I say, implementation. It's not just a mini tech project. It's not just a case of, well, we've paid for this, we've bought it, it's going to work. Going back to my previous point, there's people involved. The readiness, the planning. People are also involved in this, and people need to understand it. The organisation need to sort of champion it, if you like. And enough time needs to be allocated for that planning, that readiness, but also the implementation phase as well. Testing might need to be done. People might need to be trained. We talked on last week's episode about things like digital literacy and so on. There's a lot of challenges at play, particularly when you're changing things from one way of doing thing or one provider to another. I think the third one would be the inspection pressure. many providers that we deal with, particularly, I'm talking 80 to maybe 85% of them, they're in a rush to solve a problem. They're firefighting. So they're immediately on the back foot, if you like. And there's that pressure in a way to sort of say, look, we need to get this in place. We've got this inspection coming up, or we've got this audit, or we've got this commissioner coming in. And there's a pressure to make things look like things are working well and things are working great. And I think that is another problem where people are just rushing. They're not really thinking. They don't care about the process. They don't care about what they should have done right. They care about the here and now. And they care about making sure they're not going to get in trouble ultimately.
So we talked before about wanting to get compliant fast.
Yes.
We have a problem here. Your system is supposed to help us solve it now.
Yeah.
It doesn't matter, like you rightly say, that there's a human time cost.
Yeah, exactly.
The training people, digital literacy, things like that. That's quite interesting. I think we'll explore that a little bit more. So the way I look at it is that I think this is a common saying. Say, look, you want to build a house while you're living in it, right? And everything is under pressure because you've got the business of living in the house, but at the same time you've got the other side where you want to fix the problems.
Yeah,
How do you expand on that? I'm saying when you think about it, the burnout for staff and the other effects on the operational side of things.
Yeah, I mean, like I say, that is a huge problem where, like I say, you've got the ongoing pressures of everything that's going on. Staff attitudes are obviously, as we know in health and social care, that they're overwhelmed, they're very busy. Now you want me to change how I'm doing maybe it's my e-learning. You've changed how we're doing our face-to-face training. I've now got to upload documents on this system. I now need to carry around this iPad or smartphone device, whatever it may be. I think it is a huge challenge. And like I say, we don't envy or judge some of these providers that are trying to do these things. We're not saying they're necessarily easy, but sometimes you do have to take that breath. You do have to take that step back and look, if we're going to bring this system in, if we're hearing how well it's working at this care home down the road or this GP practice, or now we've got league tables and things like that, why is it working there? Why is it not working there? So, yeah, I think it's a really valid point, and how you tackle that, you could do a whole podcast on that itself.
Yeah.
But yeah.
Look, that's interesting. If we go back a little bit, the two slides in this series, the two episodes in this series that we looked at, one was the plug and play illusion,
Yes.
which is wanting to be compliant fast, and the other one was digital literacy is a hidden barrier. Right, in health and social care, but mostly in the adult social care sector. How do those affect or link with implementation timelines from your experience?
I'd probably say they're inseparable. They're inseparable because if a team, like say, buys into the plug and play idea, they're probably budgeting a 1 to 2 week rollout. They're saying, look, you can buy this, it can be ready, sent out, everyone's using it. And like I say, if digital literacy then is low amongst majority of the team or even some members of the team, the training and adoption process then takes even longer. So like I say, I've dealt with many clients. I think we may even have used a similar example in that episode you're referring to, where, I've spoke to a medium-sized care group. Obviously, I won't name them. They expect to be live within 4 to 6 weeks. But they're subscribing to various parts of our ComplyPlus software. This company, it's not just a case of people who are doing 1 or 2 training courses or e-learning courses. They're actually subscribing to various aspects where they've got policies, they've got documentation, they've got e-learning. They want certain types of reporting.
Some sort of integration as well.
There was integrations involved with internal systems, HR systems, and so on. And you sort of think, that's a challenge, and even for us as a provider, you have to be really realistic. But what a lot of them don't factor in is that half of even the senior members, let alone the people working on the ground floor day-to-day things, that they weren't actually confident with digitally. They weren't digitally confident, which I know we've defined in one of those earlier episodes. And that makes it a real struggle because we try and design our system to be as intuitive and easy to use as we can. However, if people are struggling, and like I said, again, referring back to that episode, if people don't turn up for onboardings, they don't use the knowledge base and video tutorials you're providing them, it makes it really, really difficult. And then that all of a sudden that 4 to 6 week timeline becomes 3 to 4 months.
Yeah.
And then 6 months later, you realise actually they've give up on the system. They've give up on the system. I think I referred to it in an episode recently where I was actually dealing with a client that were up for their renewal, but they'd only used the system for about a 2-week period in 12 months. But they're coming back to buy again because they need it.
And they need the illusion that they are compliant as well.
Yeah, exactly. And almost paying for that evidence, if you like, which again, we obviously don't condone, but we're there to try and help people and change attitudes, change mindsets. That's why we're talking on this podcast all the time.
So the way I'm looking at it as scribbling there, that it's not just the technology here. It's not the technology even that is the problem in most cases. It's readiness.
Readiness is a problem, and having, like you say, realistic expectations. I've always, the 80-20 model, implementation success, is 80% prep and 20% configuration.
Yeah.
If you're not prepared, then you're prepared to fail, as the saying goes.
So they flip the ratio instead. They want to get everything with 20% effort.
With minimum effort. Yeah.
So look, the way to look at it maybe, and I think you and I have discussed this a lot, sort of say, and tried to highlight the hidden phases of implementation, right? To say, if we're going to get practical really, we're talking about organizations managing 6 to 10 compliance systems of sorts, from HR, from recruitment, policies and procedures, e-learning, many different systems that they're using, care planning systems. What are the hidden phases of implementation that people often overlook from your experience?
Yeah, I think it's a really good question, and probably not something many decision makers actually consider. I know there are some really sort of diligent and people that do due diligence and so on before procuring systems. But the 5 that myself and obviously some of the research team we work with came up with, the first one was discovery. So it's actually trying to understand what the system is meant to achieve. What's the purpose of bringing this system in? It's not because Jill down the road said it's a good system. It's not because you're seeing it all over your Facebook or your Google advertising, which obviously these adverts follow you around now when you're talking about them, even when your phones are around. A lot of people skip that phase, and I think it's a really important phase in any form of business to sort of say, if you're going to bring a supplier in, even when you look at recruitment, if you're going to bring this person in, what are they there to do? What purpose are they serving? So don't map, the key really is they don't map their processes, so they end up digitizing chaos ultimately, and then the output is very poor. I'd say the next important one would be the data prep. So, like I say, a lot of people are moving from older systems or archaic systems that have been in businesses for years and years and years, where you've got things like spreadsheets, maybe paper files that have errors, there's duplicates, there's missing fields, inconsistent dates. Cleaning that up can take a lot of time. And it's very important that, particularly when you're getting a new system, that you're putting good data in so that you don't get the bad data. You don't get the bad data coming out. The third one that we came up with was configuration and testing. So who's using the system? What permissions are they going to need? How is the system going to be worked? How are people going to maybe access this system, depending on what it's been brought in to do? Going back to point number 1, what are some of the user journeys? Have we done some actual testing? How reliable is this system? Does it need access to the internet, for example? If it does, and your internet in your workplace isn't very good, then already this system is bound to fail, because the time when you probably need it, that Wi-Fi will go down. So I think, again, people need to be realistic with these systems. They need to bring it in, they need to test things, they need to have user cases, and before actually signing it off and implementing it 100% and start using it, whether it's when they're engaging with service users or patients, or even for a sort of foundation of their compliance, it's really important to make sure the configuration and testing is done. That leads then on, obviously, nicely to training and adoption, where you're now dealing with the people, the human side of things, where you're sort of saying, look, it's repeated reinforcement ultimately. there needs to be ongoing support. Yes, there needs to be an onboarding and induction process to this new system as well, but there has to be that ongoing support. You have to try and get feedback. You have to try and understand how best members of the team can adopt it. Again, going back to the digital literacy point, do people need some more help using some digital tools? It might not actually be specific training for that system you've brought in that they need. Maybe there's some other areas that if they were better in, they'd then be able to use that system better. So I think that's another really important point. And the fifth and last one we came up with was embedding and improvement. So the system's live, but people are still learning, as we've said. There's got to be an ongoing process. So, like I say, it's really, really important to always keep learning. Keep learning where the system's working well. Keep learning where the system's maybe not working so well. Is further training needed now we've gone live? Have we been measuring the results from using this system? Is there a better way to use the system? Are we also keeping up to date with updates that system is having? Because a lot of digital systems now will update. Anyone who uses Apple technology and the iOS software, for example, there's an update all the time. I don't even know what version they're on. So we've seen it with a lot of our clients. We've just recently launched a CPD tracker without trying to plug it too much. We're actually giving it away for free for 12 months. I looked at some data yesterday with our IT team, and you realise that although the uptake has been great, considering how many users we have on our system, there is still a lot, thousands and thousands and thousands of people that aren't using it.
Yeah.
And this, again, if you don't do this stage about improvement and keeping in touch with the updates, these are things you're missing out on. And sometimes they don't even cost more money.
Yeah.
They can actually just be
It's
part
just,
of the
it's
service.
just an add-on to the system, isn't it? Yeah.
Exactly.
I scribbled a few notes here. If I can take you back to data prep, that you and I know that one of the biggest challenges is ownership. And I think you've talked about this a lot as well before in other podcasts, where you are now waiting for the data so that you can start to set up test accounts for the client. And it takes forever to get responses. Sometimes the data are incomplete, and there's no clear ownership as to who the person you're supposed to be dealing with is. Although you are given a named person, they're too busy actually doing all the other stuff, or maybe they haven't even been involved in the negotiation.
Yeah,
They don't know
what's
actually
going
what
on.
value this is going to bring. To them, it's just an additional chore. And then you end up spending 3-4 months to do something that could have been done in 4 to 6 weeks or even less. I think that's one of the challenges there, to sort of say ownership is really important, just to add on to the points that you have raised there. I like the framework, and I like the phrase digitizing chaos. Coming from healthcare, actually, there's that where, there's initiative fatigue because we're trying to digitize everything without taking into consideration actually how it's going to affect what's happening in practice. So if the manual process is broken, automating it is not going to fix it, really, isn't it? What are your experiences of that?
Yeah, exactly. If the fundamental process isn't working, whether it's now going through a different system or a different channel, or you've got the wrong people working on it, you go back to that point about trying to get the responsible person and the named contact for the accounts that we set up, and when we enroll people on or induct people onto our system. It can be chaos because they're very hard to catch between 9 and 5 now. I think the art of telephone calls is dying. In my experience in this industry right now, even yesterday I tried to reach out to about 6 or 7 people. I only found their voicemails. You then send the follow-up email and eventually they will get back to me. But quite often the scenario is we try and give ourselves enough lead time, as I'm sure other providers who are providing similar services do. And then you get a phone call out of the blue at 4 o'clock on a Monday or 9 a.m. on a Tuesday, whatever it might be. And it's like, okay, what data do I need? I need to send it you today, and I need it to be set up by tomorrow. We've got, they'll lay on they'll lay it on thick, and I suppose, look, they need to get what they want. So I do sympathise with these people, but that again, that's a problem in itself, because even thinking that you can get all this data right, get it checked, make sure it's actually accurate before inputting it into the system, the amount of times we've had to sort of export stuff out of the system, start an account again, remove documents because maybe the wrong document was added or it's been labelled incorrectly, because it's the rush mentality, it's the instant compliance sort of mindset again.
Yeah. And you've got to think about the psychology of change as well, isn't it?
Yeah.
Because in your case, you've spent over a decade now working with different types of health and social care organizations. People working in the NHS, in the big private healthcare companies, to startups, small to medium size. How does that look actually inside organizations? What are those things actually that's around that psychology of change that leaders often underestimate or even miss completely?
Well, it's almost like a change anxiety, isn't it? There's an anxiousness about it, and obviously in a society now where we use the word anxiety a lot, I think it's embedded into people now. Oh, we're doing something different, that the guard goes up. I think to break it down, there's obviously the point where people fear looking incompetent, particularly in regulated sectors, because there is high scrutiny all the time. And if you look like you don't know what you're doing and you behave like you don't know what you're doing, the answer is to commissioners and people above you or auditors that you don't know what you're doing.
You're incompetent.
And you'll look foolish and you'll look incompetent. I think that is a big fear. I think there's also the fatigue to sort of say, look, we've done it this way for so long. What's the real problem? We're rated good or from Ofsted or from CQC. Why do we need to change? Why are we trying to do things differently? And I think there's that fatigue, like I said, particularly in many of the care settings where managers, carers, other people, on shift, they're doing long shifts, usually 12-hour shifts, so many times a week. They're sort of now thinking, oh, now I need to learn about this. Am I going to have to do that in my own time? Am I going to be paid for this? I'll probably try and do it usually towards the end of a shift as well, where fatigue and the idea of concentrating on something is very little.
Yeah.
So I think, for me, they're really, really important things. When you sort of break down that barrier, it's not just a case of people wanting to complain for the sake of it. I think there's that change anxiety, which probably does spiral into more examples. But I think they're the two key ones that are the ones probably to focus on. Yeah.
Yeah. So I've spoken to people who are in charge of, say, systems. They're in charge of, managing teams, leading teams, and they feel like they're being told to use this, use that, without any input at all.
Yeah.
They
Or any
describe it
support.
feeling like punishment, like it's almost like I've gone back to school and I'm being punished,
Yeah.
And then the empowerment as well, it's disguised as empowerment. This is going to make your job easier.
Yeah.
I think we would probably need to have a full podcast talking about who is the customer at the end of the day. Is it the compliance manager or the business owner who's bringing in the system? They've evaluated the system and they think this is going to be better for us as a business. Or is it actually the managers who are then managing frontline teams to deliver a service, but who have not been involved perhaps in the decision to bring in this system?
I think that
in the first place?
communication process, that procurement process, the rollout process, the planning process, I think is a really good theme because, again, there's a lot of ideas and value that I think we can add from our experiences. But I agree, if someone slaps a book or, in this case, an iPad or a tablet in front of you and says, look, this is a system we're using. I need you to do this, this, and this on it. I need it by Friday before you go for your weekend. Yeah. It's very different conversation to saying, look, we've bought this system and we know that we're struggling in this area as a business, or we know you guys are maybe doing a process that takes 3 times longer. We're bringing this system in to make your lives easier. All of a sudden, the conversation is different. Like you were saying there about you're empowering people, they're likely to engage. I'm not saying everyone will be happy because it's still change and you're still going to get that bit of anxiety. But I think often, again, if that time isn't taken with some of the members in the team, like you say, that communication process, understanding process, if it is a busy manager who's just saying, look, I've been given this from the hierarchy, this is how we're doing it, I don't want any questions asked, just get on with it, you're going to have more problems,
Yeah. Look, I think that's really interesting. We're talking here about mindset, actually, as a necessary method, helping to change that mindset by bringing people in early enough, discussing actually with them. I remember talking to a senior leader in the NHS, and they were saying that what I feel we do as leaders is think we know what's best for our teams. Because now I'm in charge of a whole workforce, for example, if I'm chief nurse, I should really go to them to find solutions, because quite often they know the solutions. But what we tend to do is we make the decisions for them, we think for them rather than including them. So, and I get this sense that culture change is disguised as technology sometimes, where you're trying to enforce culture change. And I kind of get it, because if you're failing maybe to meet certain audits, for example, you maybe are bringing technology to strengthen that area, but then you don't, if you don't bring people along, they're not going to buy in, and they'll show you in other ways, maybe by not using the system or not using it as intended, or maybe we ignore some of the unintended consequences as well of aggressively sort of digitizing like that. Yeah. But so I don't know. Look, when implementation fails, what do we do then? Because I know we've talked about some of the challenges around this area to say, projects go wrong inevitably. And what are the sort of patterns that you have seen leading to stalling? You mentioned stalling, actually, projects stalling and even collapsing in the end, where they've signed up for a renewal every year, but then 12 months later, they've only used it in the last 3 weeks of the year.
Yeah. No, I think it's an interesting one. And again, when we were doing the preparation for this, I think there was 4 main ones that we'd rack the brains of some of our customer teams. I think the first one is always the unclear ownership. We talked earlier about the responsible person, the contact person. If no one's really accountable and it's just something hovering on their desk or hovering around their sort of job title, if you like, no one's driving it, no one's accountable, so no one really cares. They're only going to care at the last minute, and that's where the firefighting mindset then, I think, comes in. The other side of it is unrealistic deadlines. Going back to the Amazon comment earlier, leaders expect to sort of say, look, we've made a decision, we've paid you, we want to go live immediately. Here's our mess from the other system, or here's all our data scrambled here, there and everywhere. Let's get going. And the problem is, because there's been no preparation, the system almost gets set up incorrectly in many ways. And then you're destined for failure as an outcome. Underestimating the testing side. So again, they may join one onboarding, but like you say, who's joining that onboarding? Are they making use of some of the materials we send people over to train the end users who are actually going to be using this system? For me, yeah. But, half the time, like I say, a lot of people don't even turn up to the onboarding. Then a few weeks later, you see they've raised a support ticket to say, how do I do this on the system? How do I do that? And you sort of think, well, if you'd invested the time when we'd asked you, you'd have had some product experts actually. Now you're having to read things where you could have had actual one-to-one learning almost. And I think the final one would be neglecting the post-launch support. So they go live, the vendor disappears, and then so does the momentum. And like we've said in an earlier piece there, you've got to be ongoing with these systems. You've got to keep up with the updates. You've got to keep learning what it can do, what it can't do. You've got to almost have that continuous testing mindset. And keep getting feedback from end users as well. So for me, yeah, like I say, people think, we've paid, it's set up, everyone's been enrolled, whether it's e-learning or everyone's been assigned their policies for the year. We'll sit back and relax. We'll put a little reminder in our calendar to say in 12 months, this system needs renewing, or we need to look at this again because our subscription may run out or whatever it is. And yeah, then it's put away. Or like you say, people either rush at the start to do everything, and then they have a 9-month idle time until that renewal. Or vice versa, where they get it, it's set up, everyone has a cup of tea, feedback, and then the last 2 or 3 weeks everyone uses it, and then they're back sort of repurchasing again for year 2. It's one or the other.
I picked up on what you said about momentum, to sort of say when the momentum disappears. I can imagine then that would create distrust. This system doesn't work.
Then
because they
you
can't
almost
do
get
what I wanted to do right now.
You almost get a rebellion then, and that's even even some of the support tickets at times you read, and it's very difficult to comprehend what sort of point they're trying to make. But ultimately, it's not saying what it says on your website, or it's not, and you sort of think it does do what we say on the website. We don't want to get in trouble with any consumer rights or anything like that, but if you don't know how to use it, and you're not using it properly, then it won't do maybe what it says on the website. So, I think momentum is key with any project. We have projects in our business, and sometimes when something loses momentum, the sort of the lull it creates, and almost in a way, it's almost like a forgetfulness at times. How do I? If you set up a system and you do a presentation in the coffee room or whatever the workplace setting is, and it's fresh in people's minds, but if you don't then start using it for 2 or 3 months, how can you expect? You've lost momentum.
It's like we buy new shoes, running shoes at the beginning of every year. Then
January sales, yeah.
then at the end of the year, they're still brand new. Look, let's start to look at some solutions here, I guess. How do we balance empathy and accountability? Because obviously, this is a people business. You need the staff. Like our colleague Helen is always talking about caring for the carers, isn't it?
Yeah.
Right. So, when things fall behind schedule, we know that actually you have to be empathetic in a way. You know that they've not used the system as they should have done. You know that they haven't invested in the onboarding properly. But then you still have a responsibility to support them. How does that, from your perspective, how do you approach that?
I think it's a balance, because obviously, we're never going to degrade or moan at customers. We're a solutions company, and if you look at what's on our website, our values, our mission statement, we're there to provide solutions and excellence. So for me, it's a balance. It's a sort of saying that, look, we'll match your effort. It's a partnership here. We're offering you a service. We want you to succeed. We're not just offering you a service so we can take your check every year or every month or whatever it is, and we forget about you. That's what we're always looking for, that sort of engagement. So I think it's a balance. If we see customers struggling, maybe there's legitimate pressures, the business is struggling, they're losing staff, they've got high staff turnover, they may have pressures, they maybe have got just a terrible recent CQC rating, there may be funding struggles, there may be ownership issues, maybe there's a merger. We've dealt with companies that are going through those processes, which is very stressful for everyone who can see what's going on, because they know maybe I'm going to lose my job, maybe this is going to happen, maybe that's going to happen. We're always going to try and be there to give people that support. I mean, we're doing it with a client right now where we're not being paid anything extra for it, but we're actually redoing their whole matrix on the system. They're moving to our ComplyPlus subscription system now, which is great, because the tracking of the compliance is a lot easier. But there's nearly 100 members of staff that we're bringing over, and they've changed the whole matrix so that these courses, they want them to be done every 3 years, every 2 years. And because we value the relationship we have with that particular client, we're going to put that effort in at that stage, because we know they're going to get better outcomes. They're going to enjoy using our product and our systems more. And it's also the gold standard way of doing things, actually doing things properly. And I think that goes a long way as well. If people are willing to put the effort in with us, I've had several calls with this client, we've exchanged several emails. So for me, it's having that balance to sort of say, look, not every company will necessarily behave the way we are. And I'm not saying we're an amazing, great company, but
are we not?
Our goal is to, well, I think we are, but I don't want to be too arrogant. The key is to make sure that, like I say, you reset the goals, not the relationship. The transparency keeps the trust alive for me. And if we show willing and the client shows willing on the other side, that's the partnership that we can create. And hopefully all problems, whenever they come, which there always will be problems or obstacles, we can overcome them by working together,
So in other ways, we don't blame, we
or judge or anything like
exactly.
that. Exactly.
So we're supporting them with their goals. That's the idea, isn't it? Yeah. Okay. Look, it's been very interesting so far, and I just want us to look at some final thoughts, really, from you. Maybe some takeaways as well for people listening out there. If you had our listeners here, actually, with you in the room, maybe we have them right now listening to us, right? What's the one truth about implementation that you would want them to take away from here? You can do 2 or 3 if you want, but what's the most crucial thing that they need to take away as far as implementing software? They've already decided what their needs are. You've agreed how it's going to work. What's the key for success?
Well, I think the headline to take away is that implementation is a journey. It's not a switch. I think then that's a really important concept to remember. The payoff, it's not coming from speed. It's not about who can set this system up the fastest, or how can we get everyone done all their mandatory and statutory training by such and such a date necessarily. It's sustainability and that idea of constant improvement. Take time to prepare the people, make sure the data's in place, make sure people are ready, make sure you've got that digital literacy and confidence amongst the key people, make sure you've got someone accountable, and set some realistic milestones for people as well. I think for me, that's really important to remember that, your go live, it isn't the be all and end all. It isn't the end of the journey. You haven't done your job by going live. It's the beginning of the learning, adapting, and constant improvement. And I think if you have that mindset, implementation is just part of the process, but it's not the flagship part. It's not the key milestone by any stretch. So yeah, that'd be my key takeaways.
Yeah. Thank you very much. What I'm hearing there is that patience will pay off.
Yes,
when
definitely.
it comes to compliance.
And preparedness,
I always like to bring it back actually to say, why are we doing what we're doing? Because we do this podcast every week. Most of the time it's me and Louis talking about things that we have experienced. I've been in this sector for over 26 years, and you've been in the sector now for over 10 years, but you work directly with people, trying to understand their needs, digitizing processes and building systems and helping to deploy those systems in place. And we feel that the experience that we've gained over the years can really help to change things out there. And I enjoy doing this, and I know you do as well. We do this, on time. We give this away to people to use, because we feel that there's need for these honest conversations actually in the sector, a sector where regulation actually is struggling at the moment.
Definitely, yeah.
Right? Regulation is struggling because the Care Quality Commission was trying to recover, still trying to recover.
Yeah.
The government is implementing a lot of changes. There are a lot of pressures. And we want to create a system here whereby when we come in actually to work with organizations, they don't waste time or take time away from the front line. So if we help to, by sharing some of these experiences and some of these challenges, actually, we hope to have better partnerships with service providers, and then help them to be better prepared, actually, whether they work with us or other companies, it doesn't matter, but better prepared for adopting any innovations, especially the software innovations that are in abundance now. And everybody's trying to sell you things. Every time you log on at your email, somebody sends you something. Even through the letterbox, you still get a lot of information.
Of course, yeah.
Yeah, so look, we're going to carry on. This is our 4th episode in this mini-series. We've got 4 more to go. So I hope you've enjoyed this episode. And as usual, if you have any questions, just send us an email. If you go to our website, the Mandatory Training Group website, you can fill in a form to get in touch with us, or you can follow us on YouTube, on LinkedIn, on Facebook.
Yeah, any of the key socials.
Then for the podcast, we are on Apple.
Yeah, Apple Podcasts, and we're also on Spotify as well. So, yeah, and I think also if people can resonate or have any other ideas and solutions to some of these problems we're tackling, we're not saying we have all the answers. It's always good, as I said at the start, to get some of that feedback from people out there who are living these experiences. We're talking about you. We're talking about what you go through every day, every year. Even when you're on holiday, you're thinking about some of these things. So, yeah, it's always good to get that side as well as feedback on the podcast, obviously, but actual real-world examples that we can bring in, and even any questions you have. Our team can obviously put them into the podcast, and maybe we can be answering your question, yeah.
Well, thank you, Louis. Thank you to our viewers for joining another episode of ComplyPlus Presents podcast. We'll see you next week.
Thank you.
Thank you.